Welcome to the Education Scholars Conversations. I'm your host, Jeff Yan. In this episode, you will hear part one of my conversation with Sharyl Toscano, professor at the School of Nursing at University of Alaska Anchorage. More links and information about today's conversation can be found on Digication's Twitter, Facebook, and Instagram. Full episodes of Digication Scholars Conversations can be found on YouTube or your favorite podcast app. Welcome to Digication Scholars Conversations. I'm your host, Jeff Yan. My guest today is Sharyl Toscano, professor at the School of Nursing at University of Alaska Anchorage. Hello, Sharyl.
Hi, Jeff.
Welcome. I have been we've shared a friend and colleague, Paul Wasco, I think for many years. Paul Wasco is also a Digication scholar. We'll put a link to his episode in our show notes. And we've had a long partnership with University of Alaska Anchorage. And I have heard a lot of good things about you and what you're doing in the School of Nursing. And we met and did some work together recently. And I was just so drawn by what you do that I thought we should really have you come in and speak with us and tell people a little bit more about your work.
Thank you.
So, Sharyl, would you mind telling us just a little bit of, perhaps just even a little bit of where you're from, and maybe starting from, where you grew up, and then, tell us a little bit of how you got to Alaska.
Okay, great. I grew up in Massachusetts. Pepperell is sort of a small town outside of Boston. Growing up, I knew I wanted to be a teacher or a nurse because the job prospects were sort of solid in both.
You achieved both dreams at the same time.
Yeah, exactly. So ironically, I became a teacher of nursing, but I went to school in Massachusetts, and then I traveled a bit because my husband was in the Marine Corps. So we ended up in Hawaii, which was my first job teaching nursing, and then moved back to Vermont, probably to get back my New England hardiness so I could move to Alaska, because having moved from Hawaii, from Massachusetts where it's cold to Hawaii where it's super warm, back to Vermont, and then here to Alaska where I've been since 2011.
So what brought you to Alaska? Was it because of the teaching position, or?
It's sort of the lifestyle, actually. You can kind of teach nursing anywhere because there's a bit of a shortage. And so I was more drawn to the lifestyle, I think, in Alaska, where my kids were young and we're sort of outdoorsy family.
Well, Alaska is certainly
Anchorage is sort of a city, but the university is really close, maybe 15 minutes from my house, but the mountains are even closer. So it's kind of a nice living situation, I think.
Yeah, that's great. Now, in addition to teaching, you also are still practicing as a nurse too.
Yeah, I teach at Alaska Native Medical Center, which is also about 10 minutes from where I live. And I work in the NICU mostly as a bedside RN. And sometimes I work on pediatrics. I've worked as a nurse practitioner for about 10 years earlier in my career, and now I'm more focused on education and the bedside nursing I do per diem. Mm-hmm. But that experience definitely informs my teaching, because one of the focus of my teaching right now in the capstone is there's been a call for more self-care for nurses. They've had some increased stress recently, increased work assignments, and even lack of access to supplies or materials that used to be readily available. So I think being, practicing in nursing in this setting, I have more current experience of what the new nurses will be graduating into, what kind of environments they'll be exposed to.
Mhm.
Um, when I graduated, primary nursing was sort of the standard uh, way that we practiced. And with how things, with the shortages, we're actually seeing team nursing start to come back, which, we haven't really focused on that in education
Mhm.
uh, quite some time. So how do you prepare students for returning to this environment that is, very different than the one that I was educated for and the one that I practiced in? So
Interesting.
yeah.
Um, One of the things that I remember being so impressed by you is that you have a really strong focus in storytelling. Um, Tell us a little bit more about that because that's, by the way, I love that, but I often find that it's these intersections of someone who's uh, teaching in a healthcare environment, in nursing, but you are taking storytelling as this sort of amazing learning tool, this amazing ways for one to express oneself and merging them together.
Yeah, and that's sort of changed recently. I've always used my practice or clinical stories in my teaching, but something I've been doing more recently is having the students reflect on their experience and tell their story where they connect it with. There's a nurse theorist, Watson, and she has these caritas. Um, this part of her theory of nursing. So the students will focus on one of the caritas and connect that with something that's happened in their clinical experience and match up. One of them is being present. And so, how was that caritas demonstrated in this encounter with the patient, or how was it not demonstrated? So the students can sort of reflect in how they might bring that in a future experience that might look similar. Um, but the important part is that they're, when they're having clinical experiences or patient experiences, not just as a student, but once they graduate, that they're reflecting on those and bringing what they learned from those experiences into the next encounter. We're hoping that that will help the longevity of the nurse. And I don't like the word resilience because I feel like sometimes saying someone's resilient is sort of rewarding a broken system.
Mhm.
And so I would like a scenario where nurses are thriving because they're supported. And I'm not sure when you say resilience, it's usually they survived, right? And that
Right.
and
Yeah.
that's sort of rewarded. But that if they're using these tools or they're really reflecting on their experience and not really judging it, but taking the learning points from that story or that experience into
Yeah.
the next one, they might approach the scenario a little bit differently. And in the student case, oftentimes when they first start writing their stories, they tend to be a bit judgy, right? Because they're coming from this they're coming
Yeah.
from this sort of textbook place where
Mhm.
everything is supposed to look a certain way, and then they enter the clinical environment and they see things happening maybe a little bit differently. And initially, they can be a bit judgy about what the nurse they're with should have done. And so
Mm.
I kind of pull these apart, these narratives that they write, and I'll say, well, how can we look at this from a strength-based, appreciative inquiry
Mm.
perch?
Yeah.
Um, and so, what are the facts of this, or without judgment, either positive or negative? You know, without judgment, what's happening here? And then we try to connect it to. We bring in a little nonviolent communication. We try to bring in the other or the student, like what are their feelings, and then connect the feeling they're having to a need that's either met or unmet. And this goes back to nonviolent communication. It was pretty long-standing, popular book. Um, but this approach, what I'm hoping is it helps. We have lots of ways that we communicate in healthcare. We have a SBAR, I pass the baton, all these little acronyms for different kinds of information and how you convey it. But none of it really gets at needs or feelings. And I feel like that's what leads to nurses burnout.
Mm,
And so working with appreciative inquiry, strength-based approach, nonviolent communication, and then this kind of Watson's caring framework, I'm hoping that that will help give students the tools they need to thrive when they enter practice instead of surviving, or
yeah.
because we tend to lose nurses, sometimes within the first year. They
Mm.
leave the profession altogether, and so we're really looking for tools that can support them.
I love what you said about this, a very specific kind. Um, you've gone a lot deeper to talk about reflection than oftentimes I have with other people, because it's sort of sometimes people talk about reflection and they just go, well, I just ask my students to reflect. I believe in it, and I go, yeah, so do I. But what does your reflection look like? And then they just go, well, I just ask students to reflect. And I go, well, I don't know. For me, is it has never worked for me when I just say, go reflect. Um, I, what's so interesting? We have a lot of overlap on this. I made a presentation in Alaska, to at University of Alaska Anchorage a number of years ago, and we were talking about reflection, and I was trying to figure out how to break down reflection in a really simple, generic way that is really easy for anyone to just pick up. I don't want it to be a very overly scholarly, sort of thing, because I want the students ultimately to be able to do it. And I want the students to understand it. So that I don't want the faculty members to take this and then get to the students, and then there's a bunch of theories behind it. I just wanted to boil it down to something. And I had this very beginning phase of the framework, which I think has some overlap with what you do, which is we break down uh, the sort of the just just two phases of the reflection. One is storytelling, and then the other is um, through conversation find significance. Um, and it sounds like it's a little bit like what you are doing, but what you said was, I think, is better. It's got a little bit more of that, really thinking about the language in which we use to approach it. So hopefully I'll borrow that a little bit as well in the future. But I like this a lot because um, sometimes I find that by breaking it down into those two phases, you can hold off on the judgment part of it, whether it's a positive, negative judgment, or in your case, the nonviolent version of it. You can hold off on that and just understanding what happened, just to get a sense of. I'm not even looking at whether it worked, just what happened first,
Mhm.
and then being able to remove myself from already coming to conclusion, and then try to say, we laid it all out, now let's take a look at what's so significant about all of this. Um, and um, and I love what you said about the nonviolent language of form of communication, and to use that as a basis of looking at this. I'll tell you what, if I ever, you know, need to be taken care of by a nurse, I want to be taken care of by you or any of your students. um, can we talk a little bit about this idea of, um, you had said that nurses, you've been focusing quite a lot on self-care for nursing, um, and that they often get burned out, as soon as they basically get into the job situation. And I think that this is the case for um, a number of fields. Education is another that's like that. A lot of people train to be a teacher. They have this passion that they want to help, um, young children learn, but then a year into it, they realize how tough it is and some of the things that they still like and love a lot of the pieces of it, but there are enough other pieces that makes them want to quit. Can we talk about that a little bit? Because I think that's a serious issue in society, isn't there?
Yeah.
What causes that in nursing? What do you think causes that in nursing?
Well, I think they're so focused, and I was talking to a student about this actually just yesterday. Um, she was expressing how in the class, where they're doing some of these activities, she's really interested in them and, her appreciation for it. But then in the very next breath, she says, "I just don't have time right now." So, and she's like, "Maybe I'll have time, once school's done, or maybe I'll have time." And I said, "Well, you'll never have time unless you make space for it." I said, and that's why we're focused on this so that you can practice integrating this now. Uh, and I kind of gave the example of, even if I'm on the way to delivery, we talk about sort of a little bit of mindfulness. I don't really push any one strategy. I kind of introduce them to multiple strategies. I think the telling the story is definitely the kind of unifying piece of that. But it explains things. If I'm headed to a delivery, I actually use that as a mindful moment because I have to walk all the way out the NICU, down the hall, find the room, and then even setting up the equipment before the baby comes. It's you do everything in the same steps every time, and it's a way to focus. Like everyone's focused on it. But if you don't use those moments that you have to kind of center yourself or do some self-care, I think nurses or other health professionals can kind of just push it past, um, and it builds up, and or even saying they don't feel something. There's a lot of things that nursing students, nurses, or healthcare, anyone in healthcare really is exposed to, probably more in one small stretch of time that somebody else would be exposed to an entire lifetime. Like it's not
Yeah.
you, so it's not the same level, but you're exposed to so much, kind of trauma, just
Yeah.
and so if you just kind of squash that down and you don't, it's like, oh, I'm just hardcore. I can't. And
Yeah,
I
you
tell,
eventually will break you down, right?
yeah, or
Yeah.
you'll leak all the
Yeah,
time.
yeah, yeah.
So,
These are I've heard a lot of people talk about this indirect or secondary trauma that you get, right? Just be exposed to it and
mhm,
um, could could lead to that because you're a
yeah.
witness of something.
Mhm.
Things sometimes don't go well, right? And yeah,
Like part of that appreciative approach that I said, particularly, students, you get to the final semester and there tends to be a certain mindset, there's, I don't think this is specific to nursing students, but sometimes it can be, a certain kind of focus. And I kind of try to tell them, what if you flip that focus and just tried to focus on from an appreciative approach, like where are the strengths? Where
mm,
is the success? And I think if you don't do that, like an entire unit can just become very negative all the time, like just focused on the negative. They almost can't pull themselves out. Um, they might even be trying to throw every strategy at it. In my current workspace, I think a lot of people have left after COVID. Um, a lot of new graduates with
mm,
lots of great energy, really good excitement, but not the same support. When I graduated, I had probably 7 or 8 senior nurses, and there was maybe 3 of us. Well, there's, like, maybe 3 senior nurses, and,
the
you know,
reverse
the
now, right?
majority of the shift is new, and so, that's sort of a struggle, but if you don't focus at all on what's going well or where the opportunities are, and you're always focused on what's not going well, um, I think you kind of just kinda continue down that road, but we haven't in the past really given people the tools to change that focus. Um,
Mm,
and when I do NVC, at first the students like, oh, this is easy. And when they actually try to do it, and I'm actually having them discern the difference between joy and happiness. Like they're not the same feeling. And they were like, well, what difference does it make? Because when you look at the other side of it and you're looking at anger, it's not, you're not angry, you're frustrated or you're, and so when you're looking at what you need to do to resolve that need, figuring out that difference between, anger and frustration, even though it might feel the same initially, it becomes really important. And I think they kind of get it the more the more we go through the semester, and some of them have started to use it in their preceptorship. But it is something that looks easy but does take practice.
For those of us who don't know what NVC is,
Mhm.
could you tell us a little bit more so that we can?
Yeah, it's a pretty old, his Marshall Rosenberg, I might get his name wrong, but it's been used, it's used a lot in Waldorf schools for kids.
Mhm.
It's a really useful technique um, for that. But it's also used in counseling. It's used in war-torn countries when they've used it when negotiators go in and they'll use NVC in different camps where they bring kids from different countries together. They've used NVC, but essentially, the elements are essentially everyone has universal needs no matter where you're from, no matter what culture. And if you can identify or match up your feelings with your needs, so you have feelings when your needs are met and feelings when your needs are unmet, and just making that connection, um, and not judging anybody for causing those feelings, like, oh, they're your feelings, right? And then the second part of that is to make requests. So, you have a feeling and a need that's met or unmet, and you make a request. But that request is a request, it's not a demand. So you have to also be open to, well, no, is the answer to your request, which is a little tricky in the healthcare setting. So we talk about that because there are situations where we can't say no, right? So you have,
Mm, yeah.
um, and then, but the appreciation piece I think is even more important, that when you're showing appreciation using the model, you're saying specifically your feeling and your met need. So the person who you're giving that appreciation to is also getting really specific feedback about what it was specifically that they did to for you to show this appreciation. Because oftentimes when we get thanks, or we don't really know what it was exactly that we did. And so if you're going to continue that behavior, showing that really specific, I felt this way and when you met this need, um, hopefully that person will continue
Mhm.
to do that specific behavior in the future. When that's not communicated, particularly when it's an unmet need, they really don't know what they're doing over
Mhm.
time,
Yeah.
and that never gets resolved. But
But this idea of just, in sort of the modern American, families today, this idea of being able to just identify one's feelings is is not a skill that we can take for granted. In
yeah,
fact, um, that's probably why there is such a huge industry in therapy today,
right,
right? We are not able
yeah,
to either identify or process these feelings and act in act to to address feelings of hurt or um, anger and you know especially the negative feelings,
yeah.
but also the positive ones.
Yeah. It's a really fun, game. I started using this game with my kids, but I use it with the students, we had one face to face. Most of my classes are asynchronous online, but, we had a few face-to-face sessions, and the students kept wanting to play Grok, and Grok is sort of just a card game. It has a stack of feelings cards and a stack of needs cards. There's all these sort of games you can go through, using the cards, but, then they wanted to play Grok over and over because it's just a very concrete way to use the model. But I remember when I used to use it with my daughter when she was younger. I remember one day she came home and she was really young, not, she might have been maybe 7 or 6.5 or something, and she was really upset with her dad. And she said, "Mama, I need to rock." And she came and she got the cards and she went over to him and she says, she lays down her feelings cards and her needs cards. And so it's a really, with younger kids in particular, it's really, they get it. They just
That's awesome.
naturally know how to
Yeah.
use it. As they get older, they kind of roll their eyes and they're like, "You're doing that thing." Just stop.
Well, they
But
probably have internalized those skills now, right?
yeah,
And
yeah.
yeah,
But the college students, for many, it's new. Like
yeah.
they've learned a different way, by saying "I feel," but you can start a sentence with "I feel," and it's still sort of aggressive language, right? Because I feel, if that's followed by blaming someone else, as opposed to at the NBC, you don't. It's you're not attributing your feelings to anybody else.
Mm.
Just so anyway, I've probably gone on about NBC a bit too long, but
No, it's not
it's
because here's what I wanted to just say how important this discussion I think is. I
mm,
think that there are lots of um, I'm a deep believer that when we have many different perspectives at looking at the world, we get better at looking at the world. And um, there are educators, education psychologists. There's researchers in all different kind of fields. I've had in many of these conversations. Some of them healthcare, some of them in STEM. They all bring um, different perspectives on how they think about reflection, for example. There are some things that tie us all together, like reflection, sometimes it's storytelling, stuff like that. I think it's really cool. But I think that what you have brought is a really fresh perspective that in many ways, I think it perhaps is one of the more sophisticated way of thinking about reflection in a very, it doesn't just have this aura around reflection. There are literally steps that we can take that can genuinely get those feelings processed, get an experience and really reflect on it and get to the significance. And I think that there's something really significant about this because there are so many people, scholars, practitioners, have tried for many years to try to say, we want to reflect. One of the things that I have found that is that doesn't work is people think that what's your reflection prompt? Because as if that's just silver bullet that I can just say, if you ask student this prompt, they will suddenly, it will solve everything.
mm,
That would have been like saying to a therapist that, what do you ask your clients? Well, I just ask them
right.
this one thing and then everything is done. It's not like that, right? There's a lot of depth into
Mhm.
layers of processing this stuff. And you are, in fact, describing a number of those layers in the scenarios in very concrete terms. So I love that. I think that's really wonderful. I think that that's an area, I'll probably tap you for this. If you don't mind, I'll probably be like, Sharyl, that thing that we talked about, do you think that we can can you publish this? Can you write about it? Can you explain it? Because
Mhm.
I really think that a lot of people struggle with it because we sort of almost inherently, instinctively, maybe we have experienced it, but anecdotally, reflection is good. It's the gem, it's the spark that we get. And we want our students to have that, but we don't know how to get them to have it.
Yeah, when you say the prompts, it makes me think of every reflection I've ever been asked to do as a student. There's always these prompts. I was like, well, that's not where my mind's going. Like, and
Right.
and I've always sort of been more toward open-ended, but then
Mm.
sometimes I could see on the educator side where you sometimes get back there's no emotion. I say, I tell the students, I need to feel something. It doesn't have to be a good feeling, but if you've reflected, I should have some feeling should be
Mm,
in this reflection. Um, and something from you, like I was talking to a student the other day, and I said, well, and somebody had described this to me. This isn't my language, but I think it was an advisor back at BC a long time ago. She was like, I want to know what's in your box. Like, so many people tell you what your box should look like, but I want to know what Cheryl's box looks like. I was like, I'm not so sure you want to know what my box looks like, but that's, I sort of took that with me in my, as a teacher, that I didn't want to always just have students repeating what I think is what my box is. I actually do want to know, what's unique about their experience and their knowledge related to whatever the topic is. So in the capstone course, the nursing capstone course, we do they demonstrate the baccalaureate essentials for the nurse. So there's 10. And for this, we use a lot of reflection, and we're using ePortfolio for that. And it does take a bit to get them going, because their initial response is to just define the essential, or just, oh,
mm,
in this assignment I did this, or this assignment I did this. And I say, well, I'm not, the assignment is just, like a piece of pottery you made. If you're, a potter, like, this is the one you like. So you're using it as your evidence, or an example of where you did this thing, but the reflection should really be about the full essential.
mm.
And, how did you think about nursing knowledge as a new student, and how did that change in your experiences over the time you've been here, or the experiences that you've had? And then they start to, they don't, it's not intuitive. I don't think they get it right away. So there's a lot of back and forth prompting, but eventually they start with their autobiographic sketch, which are very unique. We have the most unique students, I think, in Alaska, because they just come from, like, some are from rural villages, some are like military families, some are like hardy Alaskans that have, been here for generations, and many are just from everywhere, because it's
Yeah.
sort of a melting pot, right? And so you have these really unique autobiographic sketches of where they've come from and how they ended up in nursing. And then somehow they all sort of relate to their narrative that's specific to each essential, and how they've met it. It's a pretty big project, and it is one of those ones when you say, how do you get students to reflect? Initially, they're just, you know, they want the prompts. But if I
Well, they're
gave
also
them
looking for the answer. What's the right answer, right?
right, and if you do that too much, they'll all look the same,
Yeah,
and then it does become busy work, and I don't want it to be busy work. It might be idealistic, but I want them changed from it. I want.
yeah. Here's a preview of what's coming up next in part 2 of my conversation with Sharyl Toscano, professor at the School of Nursing at University of Alaska Anchorage.
The stories, like, often I would bring students over to the hospital too sometimes, and I would disappear, like, literally for 40 minutes. They'll say, well, where were you? And I was like, well, I just got the greatest story. If you go into a room and you start talking to an elder. And so, I don't know, I don't know if that answers your question, but it's a very different way it's more of a narrative medicine approach that I would take with my patients at the hospital, where I try to figure out the story, as opposed to, like, coming in with a, checklist of what are your symptoms. Or you're not going to get very far if you approach health in that way.